Okay, good morning. Okay, so today we'll discuss about the ribs, okay, typical ribs and atypical ribs. So the ribs are carved strips of bone which stretches posteriorly from the thoracic vertebra to the anterior lateral edge of the sternum. Okay? And they are ribbon-like structures, elastic bony arches and flat in shape. Okay? And costal cartilages, এই বানানগুলো ভুল আছে কিছু কিছু. Costal cartilages are joined to the anterior ends. Okay? And via the costal cartilages, the ribs are joining with the sternum. And the costal cartilage and ribs together makes the costa. The large part of the thoracic skeleton is created by the ribs and their costal cartilages. Okay, you have seen the skeleton there in the dissection hall. Thoracic cage is formed by the ribs and the costal cartilages. Okay, so the large part of the thoracic skeleton is created by the ribs and their costal cartilages, and normally there are 12 pairs of ribs. Okay. So how the ribs develop? Ribs appear as the mesenchymal condensation in the somatopleure, and chondrification starts immediately after the birth. And ossification begins towards the back and spreads rapidly forward towards the anterior end of the rib, and a segment remain unossified which persists as the costal cartilage. Okay, so next we will discuss the thoracic cage. Okay, so thoracic cage is skeletal framework which supports the thorax. Okay, so this part is the thoracic cage which lodges the heart and the lungs, and its nature is osteocartilaginous and elastic. So osteo matlab bones forming the thoracic vertebra and the ribs, and these are the costal cartilage, the brown colored portions. These are formed by the costal cartilages. Okay, so the thoracic vertebra, ribs, costal cartilages and in front the sternum form the thoracic cage, and it gives protection for the internal organs of the thoracic cavity and supports the superior trunk, pectoral girdle and the upper limbs. It has a significant role play for raising or reducing the intrathoracic pressure to ensure the mechanism of respiration. Okay, so main function of this thoracic cage is helping in respiration. Okay, so the ribs are a set of 12 bones which form the protective cage of the thorax. They articulate with the vertebral column posteriorly and terminate anteriorly as a cartilage known as the costal cartilage. See here the rib cage, this anterior. First we are, according to features, we are dividing the ribs into typical ribs and atypical ribs. So typical ribs are 3rd to 9th rib, and atypical ribs are 1st, 2nd, 10th, 11th and 12th rib. Okay, viva MCQ board the ribs puro bones viva hobe, very frequently asked question. So the normal ribs have same general features, the typical ribs have same general features. On the other hand, the atypical ribs have special features and thus can be discerned from the rest of the ribs. Okay, so according to relationship with the sternum, it is divided into true ribs and false ribs. Those which are articulating with the sternum via the costal cartilage directly, that are known as true ribs. 1st to 7th ribs are true ribs, and false ribs 8th to 12th. Lower 5 ribs are false ribs, and true ribs articulate with the sternum anteriorly. On the other hand, false ribs don't articulate with the sternum anteriorly. Okay, these are the false ribs. Okay, 8th, 9th, 10th, 11th, 12th. এদিকে আছে 11, 12. So these are false ribs. Lower 5 ribs. 11, 12 are floating ribs. They don't have costal cartilage. Just tips are covered with some cartilage. And rest 8, 9, and 10th, they have costal cartilage, but the costal cartilage is not directly joining with the sternum. Costal cartilages are joining with the costal cartilage above. Okay, understood? So these are false ribs. Next, according to their articulation, they are divided into vertebrosternal rib, first to seventh. These are the first to seventh. See here. Here from here, first, second, third, fourth, fifth, sixth. Okay, here, first 7 ribs. They are articulating with the sternum. So these are the vertebrosternal ribs. Okay. Vertebrosternal ribs join posteriorly with the vertebra, and anteriorly with the sternum. And next 8 to 10th, 8, 9, 10th, these are vertebrochondral ribs. Vertebrochondral ribs join posteriorly with the vertebra, here posteriorly with the vertebra, 8, 9, and 10th. Okay, and anteriorly their cartilages join the cartilage of the higher rib, here 8, 9, 10th. Next is the vertebral rib or floating rib. These are 11th and 12th ribs are vertebral rib or floating rib. And the vertebral or floating ribs join posteriorly with the vertebra, but their anterior ends are free. Okay, see here, this 11th rib and 12th rib. On this side, one is 11th rib and 12th rib. These two are the floating ribs. Okay, understood? So arrangement and general outline. The ribs are arranged one below the other, and the gaps between the adjacent ribs are termed intercostal spaces. So ribs in between the space is the intercostal space. We have discussed already intercostal space and their contents, the intercostal muscles, neurovascular bundles were present. The length of the ribs increases from first to seventh. You can see from the thoracic cage, first to seventh, they are increasing in length. After that, slowly falls, the length becomes shortened. So 7th rib is the longest rib. These points are important for your Viva and MCQ. Okay, 7th rib is the longest rib, and the transverse diameter of the thorax increases progressively from 1st to the 8th rib. Thus, the 8th rib has the best lateral projection. Okay, you can see here, 8th rib at this level, thorax is highest in transverse diameter. Okay, so the transverse diameter of thorax increases progressively from 1st to 8th rib, and thus 8th rib has the best lateral projection, and the ribs are arranged obliquely. You can see its ribs are directed arranged obliquely, and their anterior ends are located at lower level than their posterior ends. Okay, so see here, this is one typical rib of right side. Okay, so you will hold it like this. Posterior end is higher in position, anterior end is lower in position, and posterior end is more medial than the anterior end, because anterior end is articulating with costal cartilage. Okay, okay, so the ribs are arranged obliquely, and their anterior ends are be located at lower level than their posterior ends. And the obliquity of the ribs rises progressively from the 1st to 9th rib. For this reason, the 9th rib is most obliquely set. Okay, so 7th rib is the longest. At the level of 8th rib, transverse diameter is highest, and 9th rib is the most oblique rib. Okay, so you remember like this, and the width of ribs slowly reduce from above downward. Okay, you can see these are more, width is more, and in the lower part width is gradually narrowing. Okay, so next we are going to costal cartilages. The anterior ends of first 7 ribs are joined to the sternum via their costal cartilages. So these are the costal cartilages, and the cartilages at the anterior ends of 8th, 9th and 10th ribs are joined to the next higher cartilages, and the anterior ends of 11th and 12th ribs are free and hence named as floating ribs. We have already seen. Next we are going to discuss the part of a typical rib. Okay, it is asked very frequently in Viva. So every rib has 3 parts: anterior end, posterior end and a shaft. Anterior end carries a small cup-shaped depression, and which joins the corresponding costal cartilage to create a primary cartilaginous costochondral joint. Okay, so anterior end where it joins with the costal cartilage, here it is forming the costochondral joint. Okay. An anterior end bears a concave depression which holds the costal cartilage, and the posterior end is composed of these three structures: head, neck and the tubercle. Shaft is the longest part and goes between the anterior and posterior end. Okay. So see here, this is a picture of a typical rib. Posteriorly there is head, neck and the tubercle. Here is the head. It has two facets separated by a crest. Here is the neck and there is the tubercle. Tubercle lies posteriorly. Okay. And this is the shaft. Here is the angle and posterior angle. Here is the anterior angle. And this is the anterior end which is joining with the costal cartilage. And you can see here, here is the crest is separating two facet, upper smaller, lower larger facet, and lower larger facet articulates with the corresponding vertebra, and upper smaller facet articulate with the vertebra above. And neck is connected with the transverse process of the vertebra via the ligament. And here is the tubercle. Tubercle has a non-articular part and the articular part. An articular part have a oval facet which articulate with a facet on the anterior surface of the transverse process of the vertebra, thoracic vertebra. Okay. After that, the shaft is rising. So head is wedge shaped and has two articular facets separated by a wedge of bone, and it has two articular facets, lower and upper. Lower bigger facet articulates with the body of numerically corresponding vertebra, and upper smaller facet articulate with next higher vertebra. And the crest separating the two articular facet is located opposite to the intervertebral disc. In between the vertebral bodies there are intervertebral discs. So the head is connected to these structures by triradiate ligaments. Okay. Okay, neck of typical rib. Okay, so we have discussed head. Next is the neck. Neck contains no bony prominences but simply connects the head with the body. It is located in front of the transverse process of the corresponding vertebra. Neck has two borders, superior border, inferior border, and two surfaces, anterior surface and posterior surface. The upper border is sharp crest. On the other hand, the lower border is rounded. Okay. So see here, one rib. Here is the upper border of the neck which is sharp, but lower border is rounded. Okay. So this is a typical rib of right side. You will hold it like this. Okay. Pen holding fashion it out. And this is more medially, anterior is more laterally and more downward. Okay. Okay, so neck has superior and inferior borders. You can see superior, inferior border, anterior surface and posterior surface. So the upper border is sharp crest-like. On the other hand, lower border is rounded and posterior surface is rough and pierced by foramina. Here is the posterior surface. It is rough and sometimes, not always, here very small foraminas are there. Okay, nutrient foramina. Next we are going to tubercle of the rib. Tubercle is situated on the posterior superior aspect of the rib at the junction of neck and the shaft. Here, this is the tubercle of the rib. It has a non-articular part laterally and articular part medially. Okay, it is lying at the junction between the neck and the shaft of the rib. So medial articular part and lateral non-articular part. And the articular part bears a small oval facet. Here is the small oval facet which articulates with the vertebra. Okay, so articular part bears a small oval facet which articulates with all the transverse processes of corresponding vertebra. And the non-articular part is rough and gives connection to ligaments. And the tubercle of each of the 7 ribs is olive shaped, upper 7 ribs. And this allows upper 7 ribs to rotate. Okay, these movements are important. Mechanism of respiration comes in your long question theory. Okay, so for thorax you have to read the ribs. After that you read the mechanism of respiration. We will have lecture class on this topic. So the tubercle of each of the three ribs, 8th, 9th, 10th is flat and they allows these ribs to sliding movement. Upper 7 has can rotate, okay, and lower 8th, 9th, 10th can slide, and the floating ribs have no tubercle. 11th, 12th is floating rib and they have no tubercle. The body of the typical rib is thin and flattened. So this is the body of the typical rib. It is thin and flattened, and it presents two surfaces, outer convex, inner concave surface, two borders, upper border, lower border, and two angles. Here is the posterior angle and here is the anterior angle where sharp bending is occurring. Okay. Next we will discuss the surfaces, borders, their attachments like this. So outer surface, this is outer surface, it is smooth and convex and presents two angles, posterior angle and anterior angle. Posterior angle is, if you are asked where is the angle of the rib, you have to say the posterior angle, okay. So posterior angle is typically referred to only angle and it is marked by oblique ridge. Here is one oblique ridge is present at near the posterior angle, and the anterior angle is marked by an indistinct oblique ridge line here, anterior angle. Next we are going to inner surface. Here is the inner surface. It is smooth and concave and presents a costal groove near its lower border. Here is the costal groove, okay. So the costal groove becomes unrecognized in the anterior part. Here it is not present, it is present mainly in the posterior two-third, and the costal groove lodges from above downward these three structures, VAN, intercostal vein, intercostal artery and intercostal nerve, and the internal intercostal muscle is connected to the floor of the groove, interceding between the intercostal nerves and vessels and the bone. Okay. So, and the intercostalis intimus is connected to the upper border of the costal groove. Okay. So, these are the muscle attachments. So, next we are going to superior border. So, inner surface there is along the upper margin of costal groove, intercostalis intimus, okay, and in the costal groove in the lower part there will be intercostalis internus, okay. And superior border is thick and rounded, you can see, and present outer and inner lips, okay. Outer lip gives connection to the external intercostal, inner lips gives connection to the internal intercostal and innermost intercostal, okay. Both are attached together along the upper border, and lower border is sharp. Here you can see lower border is the sharp border, and it creates the lower border of the costal groove and gives origin to the external intercostal muscle of this space, okay. So see here the section of rib, it looks like this. Here is the costal groove of the rib and this is the cut section from here, okay. Here head is articulating with the two vertebra, lower larger facet with vertebra of same number and upper smaller facet with the vertebra above, and the crest is lying at the level of the intervertebral disc, okay. So here is the head, this part is neck, here lies the tubercle, here is the angle, this is shaft, here is the anterior angle, anterior end is articulating with the costal cartilage, articulating with the sternum, okay. And on this side you can see the articulation of the these are the ligaments have been shown, okay. Posterior costotransverse ligament like this, and we will discuss those ligaments. And attachment, you see, head is articulating with the body of the vertebra, neck is lying opposite to the transverse process of the vertebra and connected via the ligaments, and the tip of the transverse process have a facet which articulate with the articular part of the tubercle of the rib, okay. Understood? Here it has been shown like this, different parts, head, neck, tubercle, angle and shaft junction with costal cartilage, okay. Superior inferior facet in between crest. Here articulation have been shown, one is head is articulating with the body of vertebra, and articular part of tubercle is articulating with the transverse process of the vertebra. Okay. The same things have been shown. Facet for articulation with vertebra, head, neck, articular facet of tubercle, costal angle, costal groove, junction with the costal cartilage. Articulation is like this. You will be asked to articulate the ribs with the vertebra during your bivertebral. Okay, so see those articulation. Vertebral body articulating with the head, tubercle articulating with transverse process. Okay, and next there will be the angle. So articulations are important. So the majority of the ribs have an anterior and posterior articulation. Anterior attachment of ribs vary. First 1 to 7 attach independently to the sternum, and ribs 8 to 10 attach to the costal cartilages superior to them. Costal cartilages above means, okay, and rib 11 and 12 do not have any anterior attachment and end in the abdominal musculature, the end within the muscles of the abdomen, external oblique, internal oblique, transversus abdominis, like this, and because of this they are sometimes called floating ribs. And see these articulations, they are forming the joints, costovertebral joint where the head is articulating, and costotransverse joint where the tubercle is articulating with the transverse process. So these names of joints are important. Head is forming costovertebral joint and tubercle is forming costotransverse joint. Okay. So posteriorly, all the 12 ribs articulate posteriorly with the vertebra of the spine, and each rib forms two joints, costotransverse joint between the tubercle of the rib and the transverse costal facet of the corresponding vertebra, and costovertebral joint formed between the head of the rib and superior costal facet of the corresponding vertebra and the inferior costal facet of the vertebra above. Okay. Next we will discuss the side determination and anatomical position of the rib. This is very important. So the side of the rib can be figured out by holding it in this type of style, that its posterior end having the head, neck and tubercle is directed posteriorly and its concavity is facing medially. See, this is a rib of right side. So I will hold it with the right hand. Okay. So this posterior end having this head, neck and tubercle will place posteriorly, and this end will place anteriorly. So anterior posterior is done. Convexity will be directed laterally. So lateral medial is done, and superior inferior is determined by the presence of costal groove. Costal groove is present near the inferior end of the rib. Okay, inferior border. Okay, so and the tubercle is directed posteriorly, its concavity faces medially and its sharp border is directed inferiorly. Also the sharp border will determine. Okay, subborder and costal groove will be placed inferiorly, and in an anatomical position the posterior end is higher and nearer the median plane in relation to the anterior end. We have said already this will articulate with vertebra, so it will be more medially placed than the anterior end, and anterior end is placed more lower down, almost 3 to 4 centimeter lower down than the posterior end. Okay, so that's how you hold it in anatomical position. So anatomical position is clear. Everyone must hold it in anatomical position. Okay, typical rib. After that we will discuss atypical ribs. Okay, so this will be the anatomical position of rib. It is a rib of typical rib of right side. Okay, like this you will see. This is also right. Right গুলোই আছে This is one rib of left side. Okay, costal groove is lower down, so you hold it like this. Left side, rib of left side. This is mainly 10th rib, atypical. Okay. Okay, so 3 characteristic features of typical rib. It is carved along its whole extent. It is angulated and presents two cups, 1.5 centimeter in front of the tubercle and 1.2 centimeter behind the anterior end. It is twisted in order that both the ends of the rib cannot contact the same horizontal plane. Okay. So there is carve, angle and twisting of the shaft. Next we are going to atypical ribs. Okay. Atypical ribs are first, second, 10th, 11th and 12th are atypical ribs as they have features that are not common to all the ribs. Okay. So first rib, it is shorter and wider than the other ribs. See here, this one is first rib. Okay. So this is shorter and wider than the other ribs, and it only has one facet on its head. You can see only one facet at its head, and for articulation with its corresponding vertebra, because there is not a thoracic vertebra above. Okay, so first thoracic vertebra will articulate with this head of first rib, and the superior surface is marked by two grooves. Here you can see two grooves. Okay, obliquely placed grooves. These are for the subclavian vessels. Vein is in front, artery is behind, and these grooves are separated by here one tubercle on the inner border, that is scalene tubercle. Okay, first rib is very frequently given in your bivertebral. Next is second rib. Second rib is thinner and longer than the first rib. Here we have one. So this one is second rib. Okay. Not. This is 11th. Okay. You have to see the end where costal cartilage is articulating. So this one is the second rib. Okay. So second rib is thinner and longer than the first rib. You have seen, and it has two articular facets. Here you can see two articular facets on the head as normal typical rib. It has a roughened area on its upper surface where the serratus anterior is attached. Here is the roughened area for the attachment of the serratus anterior muscle. Next we are going to rib 10th rib. 10th rib only has one facet. This one is 10th rib. Okay. It also has only one facet at the head for articulation with its numerically corresponding vertebra, and 11th and 12th rib has no neck, only contain one facet, no specific features. This one is 11th rib. Okay, 11th rib, and this one is 12th rib. You will hold it like this, 12th rib, and this one is 11th rib of this side. This is from a right side, this is of left side. Here the concave surface will face medially and upward. Okay, you can see here concave surface is facing medially and upward. And for second rib, first rib will be like this, two ends there is 4 centimeter difference. Okay, and this is more medially. Here is the facet articulates with costal cartilage. It is a flat end rib. It has inner border, outer border, superior surface, inferior surface. And this second rib you hold like this, concave surface is facing medially and slightly downward. Okay, you can see from the arrangement here. So these are the atypical ribs we have. So we will discuss these first rib and these atypical ribs in details. So first ribs, it has important features, specific characteristic features. It is highest, shortest, strongest, flattest, most carved, most fixed and broadest rib. Okay. So all those features have first rib. The shaft of the very first rib slopes obliquely downward and forward to its sternal end. See here, this one is first rib. It is sloping downward and forward towards its sternal end, and it only has one facet on its head. Here it is articulating with the vertebra. It only has one facet on its head for articulation with its corresponding vertebra. There is not a thoracic vertebra above, and the upper surface has two grooves for the subclavian artery and subclavian vein we have discussed, separated by the scalene tubercle for attachment of scalenus anterior muscle, and it no angle, no costal groove. Okay. So this one is first rib, and you place it on a flat surface. If it is in correct position, the two ends will touch the flat surface. Okay. So this is a first rib of left side. So this will be the anatomical position, first rib. And if you place it like this, you can see the head is above the ground, not touching the head. Okay. So this is the first rib of left side. Okay, that's how you determine the site for first rib. Understood? And concave surface will be medial, convex is lateral, that you know. And the for articulation for costal cartilage will be anterior, head neck tubercle will be posterior. Okay. So this is first rib of left side. Understood? You have to determine the side. See here the first rib. Oof. First rib have a head here, head, neck, tubercle. Okay, tubercle has both parts, articular, non-articular part, and here is the two grooves. Anterior one for the vein, subclavian vein, posterior one for the subclavian artery, and in between there is scalene tubercle in the inner border, that is for articulation with the scalenus anterior muscle, and anterior end is articulating with the costal cartilage. See the relations and muscle attachment of first rib. First is very important. Okay. So posterior to the neck there is costotransverse ligament connecting it with the transverse process of first thoracic vertebra. Tubercle is articulating, and along the outer border there is attachment of external intercostal, some part of the serratus anterior. Okay. And along the inner border there is attachment of the suprapleural membrane or Simpson's fossa. Okay. And from the inner border of the rib, the upper part of the lung is called the apex of the lung, from this level above. Okay. And this apex of the lung is covered by this Simpson's fossa or suprapleural membrane, okay, which is attached along the inner border of the rib. And the vessels are crossing, you can see anteriorly subclavian vein, posteriorly subclavian artery, and in between the tubercle there is a muscle, scalenus anterior muscle. Posteriorly those muscle is scalenus medius, okay, and anteriorly here is attachment of costoclavicular ligament. You have read during the clavicle, costoclavicular ligament, other end is attached over first rib, and here is the attachment of the subclavius. Okay, understood? And anterior to the neck, four structures are related. This is also important. Here costal groove is absent, you know, so those structures will pass just in front of the neck. Okay. So most medially sympathetic trunk, then intercostal vein, supreme intercostal vein, superior intercostal artery, and T1 nerve root. Okay. After passing there, it will cross the first rib like this. The yellow colored line is representing the T1 nerve root. Okay. T1 will join with the brachial plexus, formation of brachial plexus. Okay. So feature of first rib, inner border presents a scalene tubercle about its middle, and the tubercle and adjoining part of the upper surface gives connection to the scalenus anterior muscle, and it gives connection to the Simpson's fossa or suprapleural membrane. Outer border gives origin to the first digitation of serratus anterior about its middle and just behind the groove for the subclavian artery. Next is surfaces of the first rib. Superior or upper surface, it is crossed obliquely by two shallow grooves, anterior and posterior, divided by a little ridge, and the ridge is constant with the scalene tubercle for insertion of scalenus anterior, and the anterior groove lodges subclavian vein, while posterior groove lodges the subclavian artery and lower trunk of brachial plexus. Okay, that is also related. And the area behind the posterior groove up to the costal tubercle gives connection to the scalenus medius origin. You have seen scalenus medius origin, and the area in front of the anterior groove and near the anterior end gives connection to subclavius muscle anteriorly near the anterior end and the costoclavicular ligament posteriorly. We have seen in the picture. And lower surface, there is lower surface is smooth, okay, and it is related to the costal pleura, okay. Next we are going to neck. Neck of first rib is elongated, pointed upward, backward and laterally. Here in the anatomical position you can see upward, backward and laterally. And the subsequent structures create anterior relationship of the neck from medial to lateral side are those four structures. We have discussed sympathetic chain, that is inferior cervical sympathetic ganglion is present here, first posterior intercostal vein, superior intercostal artery and ventral rami of first thoracic nerve. Okay, you can remember like the mnemonic chain pulling the van. First is sympathetic chain, then there is VAN, vein, artery and nerve. Okay. Next is side decision of the first rib, side determination. Side of the first rib can be figured out by supporting the rib in this manner that its bigger end is directed anteriorly and smaller end is directed posteriorly. And the surface of the shaft has two grooves divided by a ridge is directed superiorly. Okay, grooves are present on the superior surface and its concave border is directed inward medially and convex border is directed outward. Okay, that's how you determine the side. And remember those points you place on a flat surface. If two ends are touching the flat surface, that is the side of the rib. So side determination of first rib, side of the first rib can be easily correctly determined by placing it on a flat surface, and when both the ends, head and the sternal end should touch the surface. If wrongly placed, head will be lifted above that level. Okay. Next we are going to second rib. Second rib have some attachments, you can see, that is serratus posterior superior, scalenus posterior, serratus anterior. Okay, these are the attachment on the outer surface and those rough impression and prominent tubercle for the serratus anterior. Okay. And other things are same, this head, neck, tubercle, all these are same as typical rib. So distinguishing features of second rib, it is thinner and longer than first rib, almost 2 times of length of first rib, and it has two articular facets on the head as normal. It has roughened area on its upper surface where the serratus anterior muscle attaches. Its shaft is sharply bent, not twisted, and thus both the ends of the rib touch the tabletop when put it on the here. You can see this is second rib. So both the ends are touching the tabletop. Okay, if you place, this is the right side of second rib. So if you place it on a flat surface, both ends are touching. Okay. Okay, so shaft is sharply bent, not twisted. Thus both the ends of rib touch the tabletop when put on it. And near its middle, the outer convex surface of shaft presents a rough impression or tubercle, and which gives connection to the serratus anterior muscle. Lower part of first rib and whole of the second digitation of serratus anterior is attached here. And posterior part of internal surface presents a short costal groove here. First rib have no costal groove, here is a small costal groove, lower part of posterior surface, which is poorly developed, and the upper border and adjoining part of the upper surface supply connection to the scalenus posterior and scalenus posterior superior muscle. These two muscles are also attached, we have seen in the picture. Next we are going to 10th rib. Okay, 10th rib distinguishing feature you have to remember just. It is single articular facet on its head which articulates with the body of the corresponding thoracic vertebra. It is somewhat shorter in relation to the conventional rib. Okay, so this one is 10th rib. Okay, 10th rib of left side. Other features are same as the typical rib, costal groove, head, neck, tubercle, all things are same. Only head has a single facet, that is the difference, and shorter in length. Next is 11th rib. Okay, 11th rib is single large articular facet on its head. This one is 11th rib of right side, single large facet in its head, no neck and no tubercle. You cannot see no any neck or tubercle. Its anterior end is pointed and tipped with cartilage. You can see the pointed end. There you will not get any groove. Other have groove for costal cartilages. Okay, and it is little angle. It angle is present. A small angle here, posterior only posterior angle, and a shallow costal groove is also present. Okay, and this region shallow costal groove is present, and its inner surface is pointed upward and inward. So this will be rib of left side. Here is the costal groove, we have to place it on the inferiorly. So it is 11th rib of left side. Next is 12th rib. 12th rib also have multiple attachments. So this one is 12th rib, 12th rib of right side. Okay. So this, okay. See here the attachments. The erector spiny group of muscles is attached over the 12th rib. Erector spiny, levator costi, these ligaments are attached, costotransverse ligament, lumbocostal ligament, and here is latissimus dorsi, external oblique, serratus posterior inferior. Okay, and on the inner surface, this is outer surface of 12th rib, and this is inner surface, lungs and pleura are related, and here is attachment of the quadratus lumborum in the upper margin, internal intercostal, lateral arcuate ligament, and the three layers of the thoracolumbar fossa are attached. Okay, along the lower margin of quadratus lumborum, middle layer, upper margin of quadratus lumborum, anterior layer, and rest of the portion posterior layer is attached. Okay, and there is attachment of lateral arcuate ligament, line of pleural reflection. The dotted line is representing the pleural reflection, and here near the tip attachment of the diaphragm. Okay, these attachments, some of them are important. Diaphragm, attachment of this thoracolumbar fossa, quadratus lumborum, this latissimus dorsi, external oblique, erector spiny, these are important attachment. Okay. Okay, so distinguishing features of 12th rib. 12th rib has identical features as the 11th, with the exception of that it has no neck, no angle, no tubercle, no costal groove, nothing, only head and shaft is there. Okay, so it is considerably shorter than the 11th rib, so short in females, and it is as short as the first rib. Length is almost like the first rib. Side determination, side of 12th rib can be figured out by keeping the rib in the style that the pointed anterior end is directed anterolaterally. See, this is 12th rib of left side. Pointed end is directed anterolaterally, and its wider end posteromedially. Wider end is posteromedially, and it is somewhat concave surface, faces inward and upward. You can see concave surface is facing inward and upward, and see from here also. Okay, and its sharper border is directed inferiorly. Here is the sharp border directed inferiorly. Okay, so attachments of 12th rib, outer surface near its tip, it gives connection to the latissimus dorsi and the external oblique muscle, and its medial half gives connection to erector spine. You have seen the attachments. An inner surface, an oblique line crossing the middle of the surface indicates the line of pleural reflection, the dotted line, and lower part of medial half gives connection to the quadratus lumborum muscle. Middle to fourth near the upper border gives connection to internal intercostal. You practice this diagram, then only you will remember. Okay, and upper part of the side long quarter near the tip gives connection to the diaphragm. Lower border close to the head gives connection to lumbocostal ligament, and which stretches from transverse process of L1 vertebra. That's why the name costal means rib, lumbar means lumbar vertebra. It connects with first lumbar vertebra. And lateral arcuate ligament is connected to it, just lateral to the quadratus lumborum, from where diaphragm is originating. Okay, from these arcuate ligaments. And upper border gives connection to external and intercostal muscles. Okay. Next we are going to clinical aspects of rib fractures. Okay, very commonly occurs in road traffic accident. So rib fracture most commonly occur in the middle ribs, okay, not in the upper or lower ribs. As a consequence of crushing injuries or direct trauma, a common complication of rib fracture is further soft tissue injury. The pointed sharp fractured ends will hit the lungs or spleen or diaphragm. These structures are frequently injured. And if two or more fractures occur in two or more adjacent ribs, the affected area is no longer under control of thoracic muscles and it displays a paradoxical movement during lung inflation and deflation, that is known as paradoxical respiration. Okay, so if fracture occurs at two ends, the fracture segment is separated and it will not move with the other part of the chest wall. When chest wall moves outward, the segment will push inward, and when the chest wall moves inward, the segment will be pushed outward. Okay, so that is known as paradoxical movement. Okay, and known as paradoxical respiration, and this condition is known as flail chest. Okay, these are important for your theory question part. Along with mechanism of respiration, this clinical aspect comes as a short question. Okay, so what is flail chest, what is paradoxical respiration, all this comes. So this condition is called as flail chest. It impairs full expansion of the rib cage and thus affecting the oxygen content of the blood. Flail chest is treated by fixing the affected ribs and preventing their paradoxical movement. Okay. Next is cervical rib. This comes as a short note, cervical rib. Okay, cervical rib, the costal component of the C7 vertebra may elongate to create a cervical rib in about 5% of people. Okay, so generally in cervical region there is no rib. So C7 vertebra, if it is forming the rib, it is cervical rib, and there will be some compression symptoms. Okay. The state might be unilateral or bilateral, and it takes place more commonly unilaterally and somewhat more frequently on the right side. Right side is more common, and the cervical rib might have a blind tip, or the tip might be joined to the first rib by fibrous groove or cartilage or bone, and it might compress the lower trunk of brachial plexus and subclavian artery, and the compaction generates pain along the medial side of the forearm and hand. Okay, because of compression of brachial plexus, the nerves will be affected, and interference in circulation of the upper lip, because the subclavian artery is compressed. Okay, it will continue as the axillary artery, brachial artery. If it is compressed, blood supply will be impaired. Next is lumbar rib or gorilla rib. Cervical rib is more commonly comes in your theory. Okay, this is also one aspect. It grows from the costal component of L1 vertebra. Okay, its prevalence is much more common than the cervical rib, but stays undiagnosed. This does not produce symptoms. That's why not given. Okay, so it is stays undiagnosed and normally does not cause any symptoms. Might be mistaken with the fracture of the transverse process of L1 vertebra. Okay, so it arises from L1 vertebra. Okay, see here lumbar rib have been shown. Okay, arising from first lumbar vertebra. Okay, understood? In X-ray plate you will see it here. This is first, second, third, fourth, fifth lumbar. After this sacrum is starting. So from the first lumbar, one rib-like structure you can see in the X-ray plate. So that is lumbar rib or gorilla rib. But it does not, no important structure is there. So no compression, no symptom. Okay, that's all. Okay, any queries from this topic? So you must know how to hold the ribs in anatomical position. Okay, typical rib. This is a typical rib of left side. Okay, hold it with the same hand to which side it belongs. You hold it like this, anatomical position of typical rib. Everyone will come here and practice the anatomical position. This is first rib. Here is the first rib, anatomical position, first rib of left side. Next there is second rib. This is second rib of right side. Okay, you hold it like this, anatomical position, in anatomical position. Next there is 10th rib. 10th rib is atypical rib. 10th rib of left side. Okay, here is costal groove. Costal groove is there. Uh, Groove for costal cartilage at the anterior end. And here is the 11th rib. 11th rib is of left side. You will hold it like this. 11th rib. Okay, and this one is 12th rib. And you have to know the distinguishing features of this atypical ribs. 12th rib of right side. Okay, so you practice these ribs and you practice the articulation. See, this is vertebral column. These are the thoracic vertebra. Here the rib will articulate like this. Head will articulate with this upper facet, and tubercle will, this costal facet on the transverse process will articulate with the articular part of the tubercle. So you will articulate like this. We have to articulate during exam. Okay. So this will be the articulation between vertebra and the rib. Costovertebral, costotransverse joints are forming. Okay, so you come here and practice.